Hello and welcome to another beautiful episode of Healthy Living, reaching you from the nation's capital, Abuja. I am Olamide Alhassan. The Federal Capital Territory has announced the breakout of diphtheria in parts of the city of Abuja. The FC Director, Public Health Department, Dr. Sadiq Abdulrahman, announced the outbreak at a news conference on Monday in Abuja. Abdulrahman, while addressing the news conference, said the disease had already killed a 4-year-old, adding that outbreaks earlier recorded in Lagos, Ondo and Kano states in January had triggered the national response by the Nigeria Center for Disease and Control. Diphtheria is not a new disease. It is one of the diseases that children get immunized against at infancy since its inception in 1974. According to WHO, the vaccination has reduced the mortality and morbidity drastically, though it is still a significant health concern, as diphtheria is fatal in 5 to 10 cases, with a higher mortality rate in young children. Today on the program, pharmacist Rotimi Alamojin joins us virtually to shed more light on diphtheria. Healthy Living, pharmacist Rotimi Alamojin. How are you doing today?
I'm fine. Thank you very much.
Thanks for coming at such short notice.
Fine. It's part of our job.
Great, thank you. All right, pharmacist Alamojin, let's talk about diphtheria. That's our focus for today. People say it's a killer disease, but what is diphtheria really?
Okay. Diphtheria is a disease condition we regard as highly contagious because of its mode of transmission or mode of the way it's spread across. It's something similar to what we had in the corona period, in the way it's being spread, because it is being spread through droplets, fluids from the body system. That has to do with cough, has to do with saliva, and anything fluidy from the body. So it's highly contagious, and these things are some of these droplets are droplets that you can't really see, especially when someone sneezes. You just see it as a normal thing, but you don't know that a lot of microorganisms have been passed from the mouth through the other person that is close by or nearby. So through droplets. So it's highly contagious, and that is what makes it a little bit very difficult to actually control, especially with part of the world where people live in very closed circles, where you see people living places that are meant for 5 people, you see people, 15 people, 20 people are living in such environments. So it is highly contagious. And then some of the symptoms, the way it exhibits itself in the human body, usually when it gets to the very advanced stage where it has to do with disturbance of the airways, breathing of the individual that is infected. And anything that has to do with control, that has to do with infection of your lungs, thereby causing inflammation in the lungs, thereby reducing, and then once inflammation occurs, the lungs or the airways that the person breathes through reduce, it constricts, and then the person finds it difficult to breathe. And then when any disease condition affects such, it's close to death already. And that is why we say diphtheria is actually very deadly and dangerous too. Yes, some of the symptoms are interwoven, and that is what makes it even a little bit more difficult. Again, same way corona too was, it's very difficult when it started too, because some of the symptoms are similar to the regular flu you get, you see people having fungal infections in their mouth, where the Yoruba call, I'm Yoruba, so where Yoruba call majata. You see people having hair, something like that. So it's very easy to misinterpret it for something else, not knowing that it's actually diphtheria. So it's very difficult to actually know that you're having diphtheria, except you have gone for a test per se. You can't really tell from the symptoms, except it has gotten to the advanced stage. So that's what makes it a little bit very difficult to control, and also very deadly.
All right, talking about how difficult it is to control, as against COVID-19, diphtheria has been with us since as far back as 1974. So why is it that for as long as it has existed, it is still very difficult to contain?
Okay, it's been difficult to contain in our part of the world, in advanced countries as Canada, US, and the rest, where vaccines are taken routinely and religiously. There's no child that is born that they don't make sure such persons take vaccines as the normal vaccines the person is supposed to take from year 0 to year 1 to year 2 up to year 4, and then the one adults need to take too. They make sure they take these things. Their medical system make sure that people take these things religiously, and so you find these things well controlled in such environments. Unlike our own part of the world, we can still see to some extent we are still dealing with polio to some extent at this time, at this period of our life. We are still finding some places we are still finding it difficult to still manage polio when the vaccines has been long out. So the same issues we are having with diphtheria, there's vaccines for it, and that is one of the best methods to actually manage and control diphtheria, because taking the vaccine gives you a level of immunity against this disease condition. So we just need to increase the awareness of our mothers, because we find that a lot of people, our level of education in our part of the world is a little bit not up to date. So you find people shying away from taking some of these vaccines because there's a lot of opinion, or they feel the government is not trustworthy, or they feel it's going to have a side effect on their children, and also forgetting the benefit actually outweighs the risk of taking this now. Because once you take the vaccine, you are actually immune to some extent. Same way WHO is working tirelessly to see that malaria vaccines are out, and especially children between 3 to 4 years, because they are mostly the people that are the receiving end of these things, because of their level of immunity, their level of their immune system are still growing. They are not, they are still growing in all their organs are still growing. So they are easily prone to infections. And when these infections come, or when these disease conditions attack them, they are prone to, they take the most heat from these disease conditions because of their body system and their immune system and all that. So we advise mothers really do.
So you were talking about mothers taking the necessary precautions, and you also mentioned the fact that if diphtheria has gotten to advanced stage, are there stages to diphtheria?
Yes, because every disease condition actually have their stages. In terms of stages, what I mean by stages is the way the bacterial load, or the viral load, or the fungal load, depending on the type of infection or disease the person is contracting. The level at which, once the disease grows, the more the load, the more you keep seeing the symptoms, and the more the symptoms keep advancing. Now, for the regular malaria, you might start with just headaches, or you might just start with joint pain, and then the more the parasite load of the mosquito keeps increasing in your system, the parasite keeps increasing in your system, you keep seeing more symptoms, and then it gets to, and that's why you say the most dangerous of malaria is when you have cerebral malaria. That is when the parasite has passed through your blood-brain barrier and gotten into your brain. So that's the stage that it can kill. You understand? So the same thing goes for the diphtheria. The regular one you just see. That's why I said the early stages can be easily mistaken for other disease conditions, whereby you just have itchy throat, you see your tongue is white. Those things can easily be mistaken for other minor disease conditions, where you just go to the pharmacy and you just get ordinary, maybe anti-allergy drugs, just because you feel you're having itchy throat. So you can easily mistake them for other things. Now, when the more it lingers, the more the bacterial load keeps increasing of this diphtheria. This diphtheria bacterial load keeps multiplying in your system. The more you keep seeing the symptoms, and that is where it gets to the stage whereby you start feeling very weak, start feeling very tired, and you're having difficulty in breathing. So that's what I mean by advanced stage of it, because at that stage now, when you have difficulty in breathing, you are beginning to think of something else. Is that maybe you're having asthma, or you are beginning to have other disease conditions that might not even be diphtheria. Your mind will not even go to diphtheria. You might think of other things, but you know that for something to to move to the stage where it's affecting your breathing, and then you're already feeling weak, you know that it has gotten to a more advanced stage than what it was from the beginning, where you're just having the itchy throat, and then you're having your tongue is wide, or you're having your lungs, when you open your mouth, from your tongue to your lungs, you can see that there's a white patch, grayish patch on your tongue and your mouth. So those are what I mean by the advanced stage of this disease condition.
Oh, okay. So now let's talk about are there types, and what are the clinical manifestations of diphtheria that anyone could see and tell that, yes, I think this is diphtheria?
Okay, we have about 3 to 4 types of them. We have the one that affects the mouth, which is the one that we are actually experiencing at the moment in our part of the world. There's the one that affects the skin. There's the one that affects the respiratory tract, which is the one I talked about. That's one by the time you start affecting your breathing, you're having difficulty in breathing. Then there's the one that also affects wound. When you have sore wounds on your skin or on your leg or any part of your body, if that wound is infected with diphtheria and someone touches it, or maybe a health professional does not use gloves, or maybe I just want to, as your brother or as your sister or your father, your mother, I just want to help you dress the wound and I touch it, I can actually contract diphtheria from them. So those are particularly the major, about 3 to 4 types of diphtheria that we have, and the areas of the body that they actually infect or affect, as the case may be.
All right, so what about the clinical manifestations? What symptoms should we expect to see?
Okay, basically the symptoms you have 4 major symptoms that you would experience. One is mild fever, which can easily be mistaken for something else. Definitely, you always have fever once there's foreign body in your system. Your body will definitely react to it by presentations of fever. Yeah, because the body is trying to fight it or see if it can overpower the foreign body that just entered your system. So your manifestations comes with fever. Then the physical ones you can see the mouth, you're having sore in your mouth towards the lungs. When the person opens his or her mouth, you will see more like a white grayish patch on the mouth, on the tongue. When you look down towards the lungs, you will see also towards the lung manifestation in terms of, it might look like a wound, might just be white patches too. Then you see some persons also, like the advanced stage I was talking about, you see the neck region, because like I said, it's the disease, the parasite, this particular bacteria actually produces what we call toxins. And these toxins, once they get to the mouth, they cause inflammation of the lymph nodes. There are what we call lymph nodes in your let me say neck region here inside. So once there's an inflammation, sometimes it manifests. You can see the physical manifestation of the inflammation also outside. So you might see some children when they start having maybe little bit of swelling on their neck region, also deafness, and then sore throat. And then when you also notice that a child is having difficulty, or a person, an adult too, is having difficulty in breathing, and the person does not have history of asthma before, but the person does not have history of anything that could cause such manifestation. So those are some of the symptoms that you notice of a person having diphtheria. Also, when it's on the skin or on the sore wound, you also notice those white patches. And like I said, some of these white patches can easily be mistaken for fungal infection.
Yes.
Because most fungal infections come in that presentation of white patches, either on the wound or in the mouth or any part of their body. It comes with that color of whitish color. But the diphtheria comes mostly with whitish and grayish in color sometimes. So you can, if you notice that some of these things are present, you are beginning to experience some of these symptoms that I just mentioned, I would strongly advise you visit the hospital and get the proper tests culture. You take a sample and then do a culture. In 2-3 days, your results will be out, and you can be sure of what you actually having, whether it's a bacterial infection or it's a fungal infection, rather than just allow it to linger.
All right. So while we talk
And then
about,
to also hard,
okay,
sorry, to also
it's
hard,
okay.
to also hard to read. This diphtheria is also, we call it most times an acute infection. Acute in the sense that it can present itself very shortly and can also go very shortly.
Go on its own without treatment.
So yes, to some extent, when it starts. So it is when you know, that's why I said when some of these symptoms present itself, some of the symptoms are interwoven with other disease conditions. So you might, once you notice that it is becoming it is going beyond 2-3 days of these symptoms that you are having, I would strongly advise you go to the hospital and get proper tested for this diphtheria, since it's an outbreak and we know it's out there at this moment.
All right. But are there people that are asymptomatic to diphtheria, just like COVID-19?
For now, I wouldn't say anybody is asymptomatic because they have clear clinical symptoms that you can observe for diphtheria. Now, in the early stages, yes, because when you contract it, you will not see the symptoms until 2 to 3 days after you have been infected. So you can still say those in between the moment of the period of infection and the moment of clinical symptoms coming out, we can say within that period that the patient or the person is asymptomatic. The person is not showing any signs of having these infections. And during that period, the person can still infect wherever it is the person wants to, that is around him or her at that period. So that's just the incubatory period of the bacteria. After that, the person will definitely show clinical symptoms. There's no way you will have diphtheria and you will not see the clinical symptoms, either in terms of the mouth being sore, or the lungs having pains in the lungs, or itchy throat, or weakness, or sometimes people will have weakness and just feel it's just malaria that they're having at that moment. So you will definitely see the clinical symptoms of. It's just that most times we might just ignore them, but they will definitely be there. You will see the clinical symptoms.
All right. So what can we pinpoint as the cause or some of the causes of this diphtheria?
Okay. Basically, the infection of diphtheria is a disease condition that people get from ingestion of live germs. Now, I know in our part of the world, it is live germs. Let me put it this way, in the way we understand. Now, microorganisms, we cannot see them with our eyes. Now, this class of bacteria are bacteria, especially diphtheria, is a disease condition where the person ingests these organisms as a live germ, and we can get these things from food. Yes. So when we buy one, people who take beef veggies, maybe salad, are not well processed or well cooked. Basically, you get, because most times these bacteria are, in fact, they are organisms that heat can actually kill most of them. So when you have well cooked food, yes. So when you have well cooked food, most of them would actually die, except the one that are we call them thermolabile. They cannot be killed by, but those ones are more advanced organisms. But this particular organism is not thermolabile, so it can actually be destroyed by it. So it is when we ingest some of these live organisms. So I would strongly advise for persons that are into foods that are not well processed, they should make sure they are getting them from well verified and well trusted sources, where they are well processed and they are well taken care of before consumption, so that you don't end up, because with the outspread of this bacteria out there at this moment, anybody can actually be infected. Anybody can actually infect anybody at the moment. Even the person that is preparing it, in the process of preparing it, the person is talking, the person is gisting with somebody else or making a call. The droplets that is coming from the person's mouth, this person is infected already, can actually pass this infection along to the foods that they are getting. So even at this period when you're getting things from the market, let us make sure when you get them, when you get back home, ensure that they are well processed before you actually ingest some of these things. Or you're buying something from the road, carrots, banana, whatever it is that you're getting at this period, let's make sure they are well cleaned and well processed before we actually ingest them. Because you don't know, like we said, a period of asymptomatic person presenting not presenting symptoms is also there between 2 to 3 days, and within that period, the person can still infect somebody else. So you can't really tell who has it or who does not have it at a particular period of time until the person starts showing clinical symptoms. So anybody can actually have it, and even getting something, maybe eating corn, all these food stuff this readily available stuff that we get to buy and eat, we can actually get infected from them. So we just have to be extra careful at this period, since we know these things can be gotten through droplets from the mouth of the person that is infected to another person.
We truly need to be extra careful because most of we Nigerians are street eaters. But anyway, let's go on a quick break. When we return, the conversation continues. All right, viewers, let's go on a quick break. Welcome back, viewers. This is still Healthy Living, reaching you from the nation's capital, Abuja. All right, pharmacist Rotimi, before we went on the quick break, you were talking about being extra careful. You even gave example of corn. Everybody loves to eat corn, and some persons will never get home before they start eating it. They buy and they eat on the spot. Now, if we have to be this careful, are you really sure that we can even be as careful as you just expressed? And another question I want to ask is, why is it that it is mostly affecting children? Because according to reports, as of January this year, over 25 persons in Lagos, Kano, and Ondo states were affected, with some cases of fatalities. And just recently, Abuja, I think 8 persons were exposed to the virus, to the disease, whichever. I think 8 persons were actually exposed to it, and 1 case was confirmed, and there was fatality. And I think a 4-year-old. So why is it that it's always prominent in children?
Okay, like every disease condition that affects children, there's always a high percentage or high degree of fatality in children because of their level of their immunity. Now, over time, as we grow as adults, we are exposed to disease conditions. Our body finds a way to produce what we call antibodies to be able to fight some of these disease conditions. And that is what the white blood cells does in the body. And that is why you see when you are sick, the first thing they do is they go and check your PCV to see how your blood, the parameters in your blood are doing, and if they are still, once they see your white blood cells is high, they know that even without doing the culture or a sensitivity test, the medical professional can actually tell that this person, there's a possibility this person is treating an infection. Might not know what infection, but this person is treating an infection. Now, for children, these children are, for this diphtheria, they are well exposed. They are more exposed to these things because they take less precaution. They play, they are free-spirited persons. So you see them playing around, they go to school, they mingle, they collect things from their friends. Especially the ones that are even crawling, you see them using their hands to scratch everywhere. And the next thing where their hand is going is their mouth for children. And you see them, so they are at more risk of exposure to these things. And then why do you see the fatality rate in them, like you just abruptly mentioned in Abuja, a 4-year-old just died from this particular disease condition that we are discussing at the moment. So their level of immunity is actually well reduced. There's a way the same malaria will affect you as a person now, as an adult, and you might decide not to even take anything, not treat it, and in the next few days, your body would naturally be able to fight it off because your level of immunity, your immune system has grown to some particular level, unlike for a child. And that is why you see most people that have cerebral malaria are usually children. And that is why malaria is one of the leading cause of death in our part, especially in West Africa and our part of the world, because of their level of immune system. And then we also know that most of these children in our part of the world are not well nourished. They don't eat well, they don't feed well, they are not taking the balanced diet they're supposed to be taking, because there's a way you would eat and your immune system will be up and doing it to some certain level and be able to fight off these conditions. So it is one of the reasons why these children are actually able to experience, why they feel this blue the more in terms of this diphtheria. And then, like I said, it affects the breathing of these children. Now, as you are growing, your organs are also growing. The muscle of Eba as an adult that I can swallow because of the size of my throat and my lungs is different from the muscle of Eba a 4-year-old or a 2-year-old can take. The same thing, the amount of air that I'm taking in is different from the amount of air a 2-year-old is taking in. Now, imagine a 2-year-old now having inflammation on their lungs, thereby reducing the space at which they used to breathe in. And an adult is also affected with the same thing. The way an adult will still be able to manage it to some extent and still manage to breathe and still manage to manage him or herself to the hospital or take care of him or herself for a few days and not result in fatality would actually be different from a child. True. Because once the airways is reduced, the child will feel more strain in breathing than an adult would do because their organs are still growing. So those are some of the peculiarities and little differences why we experience most of these fatalities in children more than an adult.
All right. Is it not ironical that we have vaccine and children are still the most hit, whereas children are the most vaccinated, especially early in life? I think there's vaccine for diphtheria, which is something around Penta or something that are given at the hospital, especially during the first few weeks of their life. So why is it that they are still the ones that are mostly affected by diphtheria?
Yeah, I can tell you that vaccine, number one, is not I'm trying to look for the word now.
It's not a cure.
It's not
it's a prevention.
It's not a cure. Yes, thank you. That's the word. It's not a cure, and it's not a jail. I'll be out of jail gate free card that you're not going to be affected with diphtheria. Now, what vaccines basically do is they reduce the rate of fatality for anyone that is going to be infected. Same thing with corona, that you were vaccinated or you took vaccines. That's why at that time we were beginning to plan. And so what's the point of taking the coronavirus now vaccine if I'm still going to be infected by corona, if I'm still prone to being infected with it? But the truth is, having the vaccine or taking the vaccine actually reduces the rate at which you're going to be affected by it if you eventually get those disease conditions or viruses or bacteria, as the case may be. Now, for this, there's a vaccine, yes, but I can tell you that a lot of persons, especially our people in the rural areas, really they shy away from this vaccine. Once they give birth and they have left the hospital, we want to give their children their vaccines, they will tell you, no, in my father's house, all of us are strong man with a bond. Our children are very strong children, they give back to our house. We don't need all these vaccines. So a lot of them actually shy away from this vaccine. That's the sad truth, even though these things are readily available in the hospitals. Now, not taking these vaccines, and that is what ends up appearing or coming to play in their later lives, in their later ages, when some of these outbreaks come out and they get infected. Now, even for an adult now that has taken this vaccine 5 to 10 years back, we are still advised at the moment to actually go back and take these vaccines again, because you can actually do a repeat of them.
Now, if you have, as an adult, because like I said, it's not just children that get infected by this bacteria, adults also get infected with this bacteria. And so we are also advised as adults with this particular outbreak that is out at the moment, if you have not, if you have taken the vaccine, because some of us don't take the vaccine when we are small. It is when we are now older that we end up going back to take this vaccine. So if you have taken it maybe 5, 10 years back, and you know you're in an environment that is prone to these things, I would strongly advise you get access to any of these government hospitals to make sure that you get vaccinated with this vaccine. It is going to go a long way in our opinions. So that's why we are trying to advocate and encourage mothers, those that have small children and those that are are pregnant at the moment, looking forward to delivery, that once you have given birth, please and please try as much as possible to ensure that your child takes these vaccines. Yes, it might cost us a little change here and there to take, but the benefit always and always we always outweigh the risks of taking this vaccine, because it's going to do the child a lot of good, even not now, in the nearest future. The child will see the benefit of taking these vaccines.
Okay, so because you were talking about getting revaccinated, does that not mean that
Yes.
even that the vaccine actually wins out over time?
It not really wins out over time, yes, but the efficacy, uh, the strength of the vaccine in your system, the work it does actually reduces with time as you are getting older. Just the same thing with other vaccines that they tell us maybe after 10 years you're supposed to get another booster dose. They call it more like a booster dose. Not really that the one you took before has finished. It's just more like re-energizing the one you took before for an adult you've taken before, but not like giving it more power because of the outbreak that is out. If there's no outbreak, the one you took before will be fine. You can still go ahead with that one. It will still do you still manage your system properly. But because of the outbreak, you are more like giving your system more power. You're giving the vaccine, you're giving your system more energy to be able to fight the outbreak better. That is what we taking it, that's what it basically does for you. So we call it a booster dose. Not like you're taking a fresh vaccine, but you're basically giving what you have taken before more strength and more power to be able to actually overcome the disease condition if you, by any chance, get to be infected by it.
All right, so let's talk about treatments. Then we look at prevention of diphtheria.
Mhm.
How can it
Yeah.
be treated?
Okay, for treatment, basically, we just have two ways to treat diphtheria. One of it is what we have been talking about all along, taking the vaccine. Even if you get infected now, the first thing you have to do is to still take the vaccine because we call it an antitoxin. Like I said, the bacteria, once it gets the system, it produces toxins, which causes all these symptoms that the body starts to experience. Now, when you take the vaccine, it's like an antitoxin. So it's working against the toxins, reducing the production of the toxins, thereby allowing your body to go back to normal and not experience those symptoms. So even if you get infected now, the first thing you have to do is to still take the vaccine. You have to still go back and still take that vaccine. If you go to the hospital, they'll still have to give you that vaccine first. So that is one of the most efficacious way of actually treating this disease condition that we are talking about, diphtheria. And then the second way of treating it is antibiotics.
Okay.
So there's some class of antibiotics that we can use, the penicillins and the rest that you can use to actually treat this disease condition. So when you get to the hospital and you've been tested and treated and confirmed that you're actually having this disease condition called diphtheria, and the bacteria, you are actually carrying that bacteria in your system, the first thing they will put you or place the person or place the patient on antibiotics to actually treat the patient and help the patient get better, because there are particular antibiotics that are suited for, or they are designed to, they work better for upper respiratory tract infections. Those kind of antibiotics will be used. I don't want to start mentioning them here so that persons will not go and start doing self-medication, or because they feel they're having some of these symptoms, and the next thing they want to do is they want to start doing self-medication on their own. So I won't want to mention some of these drugs that they can use to actually treat this infection. The best thing is when you're having symptoms, and that we have mentioned, the sore throat, the white patches on your mouth towards your lungs, you're having pains in your throat, you have difficulty in swallowing, you're having difficulty in breathing, strongly advise go to the hospital or go to the pharmacy. If you ask for a pharmacy, they will rightly guide you on what to do and what next step to take to actually manage this disease condition before it gets out of hand.
All right. So does that mean that it is treated by symptoms?
Yes, it can be treated by symptoms. But like I said, some of the symptoms are interwoven with other disease conditions. So we can't clearly say on this is a particular disease, we're having diphtheria until it has been cultured and the test result shows that you're actually carrying this Corinae bacterium that is diphtheria that is causing diphtheria. Until it is tested and it is confirmed that you're carrying that Corinae bacterium diphtheria, which is the parasite that is causing the diphtheria that we're talking about now. So we can't really treat by symptoms, because if you want to treat by symptoms, you'll be treating other things and not bacteria. And you can't be sure that you're having diphtheria until it has been cultured and the test result is showing that you're having this condition. You can only just manage the symptoms pending when you go to the hospital, just to be sure that you're having this diphtheria or not. In the early stages where you're still having the itchy throat or you're still having a little bit of difficulty in swallowing, it can just be as a result of allergic reactions, maybe because of the weather condition that we're having. We're having a lot of rain in this case. So you can be having flu. You can also be, so you cannot be managing those conditions. But once it's lingering beyond 2, 3, 4 days, strongly advised to go to the hospital, let them carry a culture, get a test sample from you, do the culture, and then confirm or strike out that you're having diphtheria or not, and then you can go ahead and manage yourself properly.
All right, so let's talk about preventive measures for diphtheria. How can we prevent it?
Okay. Like we already mentioned, prevention mostly has to do with what we have been talking about, since ensuring that you're getting things from trusted sources. And even if you don't trust the sources, because we have to go to the market, we have to buy things, we have to make sure we have to eat. So any which way, we have to eat. So we have to make sure that we get these things from trusted sources. That is one. And then one of the also prevention, in as much as it's also treatment, it's also prevention. That is the vaccine. Make sure you get these vaccines. As an adult, as a child, those of us that are parents that are having children, take them to the hospital, let them be properly vaccinated. As an adult that you have taken these vaccines for a long while, try as much as possible to get to be vaccinated, get the booster dose that will also make help you to get yourself better. But basically, those are the two major ways we can actually prevent this condition, because it is, like I said, it's very difficult to manage. It's very difficult to prevent because of the mode of transmission, which has to do with droplets. You can get it through kissing, you can get it through sneezing, you can get it through coughing, you can get it through any blood body fluid can be used to pass this disease condition across. So we just have to be very careful and make sure that we do our own part and leave the rest to God.
This mode of transmission you just mentioned now is making me feel like we should have actually, left the culture of the face mask, the nose mask on.
Exactly. True. Yeah. I think we might have to. I was discussing with someone yesterday, and I was telling the person we might have to, for the meantime, have to go back to the culture of face masks at the moment, because the truth is the way it's been transmitted is almost similar with the coronavirus that we had some years back. So we might, for our own safety and our own good, we might just have to go back to the culture of face masks at the moment for the period before this outbreak wears off or phases out by itself. So we just have to protect ourselves. And one of the best ways to protect ourselves at this moment is to actually go back to the culture of taking face masks, especially when you are going to crowded areas. Once you are leaving your house and you are going to crowded areas, try as much as possible to make sure that you are wearing face masks, because there's a lot of flu out there. Like I said, this period we are in the rainy season, and there's a lot of flu out there. You tell a person sneezing, you tell a person coughing, you don't really know what the cause of their cough is, you don't know what the source of their sneezing is. It might just be diphtheria or it might just be a flu, but we can never detect until you have done a test. And nobody will carry their test results and be walking around. Everybody is just managing themselves. So to protect yourself and protect your immediate family, especially for mothers and parents that have little children at home. And the sad part of it is these children easily get infected with these things, but more than the adults because of their level of their immune system. So you as an adult, you might even pick it up and your immune system will be trying to fight it. But immediately you drop one cough or you drop one droplet at home of sneezing, your child can easily pick it up and start exhibiting the symptoms almost immediately. So it is for your children's sake and our own sake as adults too. I would strongly advise if we can go back to our culture. I think the nose masks are cheaper now. You can get as low as 15 naira for one now.
Don't forget that everything skyrockets when there's an announcement of wear your nose mask. The price is going to go up.
True, that's true. That's true. But in the interim, if you can buy as much as you can, do that, and then keep for your family, keep for your friends. I think there are places for crowded areas now, banks, churches, and also do a lot of good in advising and ensuring that people comply to taking this nose mask. I think in the next few days, in the next few weeks, we might start seeing decisions rolling out or communiques coming out as regards this in ways to protect ourselves, in ways to be more careful, and how to make sure that this outbreak does not go beyond what it is at the moment, because we are already experiencing fatalities, and nobody prays. We are already having enough on our head in this consideration to add the diphtheria to it at this moment, where people will start dying as a result of diphtheria. So let's just try as much as possible get the vaccines, get your nose masks. If you're getting food, get them from trusted sources. Places the person that is taking care of, that is giving you this food, they have very well and high standard personal hygiene. To really be buying meat from the market. You see that place can be very, very dirty and very very unkept at some time. So try as possible to get these things from trusted sources that you can vouch for, and your places you'll be using over time, so that you don't fall victim of this disease condition that is out there at this moment.
All right, thank you very much, Pharmacist Rotimi Alamojin. Thank you for your time, and thank you for sharing so much information with us. We really appreciate you.
You're welcome. It's my pleasure, man.
All right, viewers, that's where we round up the show for today. You've heard from Pharmacist Rotimi. You need to take precautionary measures and make sure that you stay away from anybody that is coughing or that has any of the symptoms he has actually mentioned, because you don't know who's actually infected with diphtheria already. It's highly contagious. Do not forget that. All right, that's how we'll draw the curtains on the show for today. I'll see you again next week. I am Olamide Alhassan. Bye for now.